back to my channel. Today I want to speak about something that I read about and I found it interesting and I wanted to present it to you. So, if you ever complained about staying in line to wait for the doctor for hours, or you complain about the taste of a pill that the doctor prescribed to you, I think you should be very grateful that you live in the 21st century, because today we're speaking about 10 dark secrets in the history of medicine that probably would have killed me and you if we would have lived in that period. We start with the first one. It's the medical cannibalism, eating mummies, properly saying. So in the 16th or 17th century, if you would have a headache or a stomachache or a cold or something, the doctor would not give you aspirin. No, they would have give you the mummy powder. Yes, exactly, the literal ground up human mummy powder mixed into a drink, because they were thinking that if you drink the vital energy of the mummy, your vital energy would increase and your body would have the strength to pass over the actual disease, actual problem that your body had. So if you had a problem in that period, probably the doctor would just prescribe to you, give to you the powder that is probably the neighbor that your grandmother had in, I don't know, 200 years before. The second secret that I read about, it's the surgery before anesthesia, the speed surgery. So in 1840s, I think, okay, this was just organized torture. Before modern anesthesia, surgeons weren't recognized as good surgeons because they were patient and they were doing their job just fine. No. They were known because they could amputate a leg in less than 90 seconds with probably 4 heavy nurses that were pinning you down to the ground, and they were just finishing the surgery before you would have died from shock from the pain or something. So if I was a doctor in that period and I wanted to be a surgeon, I probably didn't know everything that I needed to know, but I need to be really quick to be one of the best for them. The third secret I read about, it's the tobacco smoke enema, and this one actually made me sick when I read about it. So the resuscitation techniques were a bit wild in the 17th century, I think. If you would have drowned and they needed to do the CPR to save you, they would have not do it. But they find out another technique that probably was working for them or something since they were doing it. Because, okay, first, I don't know exactly who thought about it, but okay. They used a specialized blow kit to blow tobacco smoke enema through your rectum, because they were thinking that the warmth of the smoke and the chemicals that were containing from the tobacco were actually giving you the power to come back to life. So next time when you want to complain about a throat swab, maybe you would think that you don't have a tobacco smoke enema into your ass, so you would be just grateful that you can be treated normally. The next one is the heroin cough syrup for babies. In the late 18th century, Bayer's, yes, the aspirin company, sold actually heroin syrup drops, okay, syrups for babies as non-addictive cough syrup. So if you wished for a baby for your whole life and your baby would just cough in the night or cry in the night because something was bothering, because they had a cold bothering, okay, you would just take 3-4 drops from the heroin cough syrup and you would just put them on the tongue of your little one, thinking that you're just calming the cough and the crying, and yeah, the kid would probably stop crying because you probably kill them or you just blank them because of the heroin that they consumed. So this is how you would have get rid of your kid if you just didn't like them or you just didn't want to raise them anymore in that period. The next secret I read about, it's the trepanation. That was actually one of the most known and used surgical procedures in history. So if you have migraines, mental illnesses, or seizures, according to the doctors, you were good to have a trepanation. So they were actually using a manual drill or a sharp stone to make a hole into your head, because they were thinking that into your head were trapped a lot of bad spirits. So they were just cleaning the area and letting the bad spirits to go out from your head. So after that, you would feel better. And I read a lot of documentaries that said that they found thousands of corpses that had this hole in their heads. So it actually worked for some of them. I don't know how. I don't know how they were living with a hole in their heads after. But they said it was a really good procedure and it was properly working. The next one, it's the mercury for everything technique. Okay, for centuries, heavy metal poisoning was considered peak healthcare. Doctor was using mercury to treat everything from syphilis to constipation. So if you were a patient, you could have seen your tooth falling and you would have drool uncontrollably. Okay, it's a hard word. Okay, and your brain would just deteriorate, and the doctors would think, oh look, the treatment is working. You can see the bad toxins going out from his body. But this was not actually bad toxins. It was actually your brain melting, going out from your body. So yeah, in that century, a lot of guys just died because of this, because probably the doctors were just deteriorating their brains. The next one, it's the ice pick lobotomy. With this one, they were actually treating anxiety, depression, or the patients that they were thinking they were unruly. I don't know exactly what unruly was meaning for them, but they were treating these patients with the ice pick lobotomy. I think this was used until the mid-20th century, so not really long ago, but this was used. So they would take a metal tool that was sharp, okay, and they were inserting it through your eye sac until they would have reached the frontal lobe. So they would have just damaged the frontal lobe. So this was their treatment. So if, of course, you would have this anxiety, depression, and everything before, you would have not have them after, because of course they just damage your brain and probably you would not feel anything, think anything, because somebody just played with some anatomical parts of your brain. Okay. The next one is the bloodletting drain to your death. I think George Washington died because of this, because he had infection, epiglottitis, and his doctors thought that this was the best treatment that they can give to him. So they were just either slicing your veins or using leeches to drain your blood. So probably we know that they drain 40% of his blood in the first 24 hours of the treatment. So this is why the guy died. So yeah, in the mid-20th century, if you would have a problem, infection usually, they would have just let you bleed until you were dead, or at least half dead, half fainted. But anyway, this was their treatment. So in that period, a lot of guys just died because they just lack blood at one point. The next one is the radioactive beauty and health products, because in early 90s they find out about radium. So everything that they were consuming, everything that you could have seen of the TV had radium in it. So if you were buying a toothpaste, probably you would have buy a toothpaste with radium because it was brightening your teeth, or you would have buy lipstick that was making your lips to pump better. It was having just radium, but instead they were just putting the disease in themselves. That was it. And the last one, I think it's the chloroform grave robbing. So med school in long time ago, I think 2000 years ago, okay, they were not having enough corpses to study anatomy on. So what they were doing, they were actually paying a resurrection man, a thief, to stole the bodies from the recent ground that was digged, okay, for the corpse. They would have sold the corpse to the med students or the doctors, not just med students, for them to study better the anatomy. So probably if you would have died tonight, tomorrow you would have been on the table for the guys just to study your organs and to see whatever they can find out for the new medicine. So I think with this one I just finished all the dark secrets that I read about from the history of the medicine. If you know others that blow your mind, or if you have any questions about this one that I just spoke about, leave me a comment and let's chat a bit about this subject, because for me it was interesting and nice to talk about. Bye!